Hi everyone. You may have heard that my name is Dalton quite a few times. I'm rather lucky because, as many of you know, I started my life in the NICU. My first 29 days to be exact. When I was born, it was a little bit of a surprise. I was born at 32 weeks, so a little early. Although I don't remember much, I've always heard my mom tell stories. She was quite young, and she was scared. Thankfully, there were plenty of doctors and nurses to help her through it, especially some of the scarier things like breathing tubes and blood transfusions. And even the little stuff, like they helped my mom celebrate when I didn't need that breathing tube after a while. I went home after 29 days, and today I stand in front of you at 13. I do theater, I play sports, I have 4 dogs that we all take care of at home, and I'm healthy, and that's why I'm lucky. I know there are so many babies and families that need help, and that's why I raise money for the UVM Children's Hospital. Thank you.
Morning, everybody. I'm John Brumstead. I have the honor of being the CEO of the UVM Health Network and the UVM Medical Center. And what a story. Thank you, Dalton. And thank you to Dalton's family for letting us bring him forward to tell his amazing story. And it really puts an exclamation point on the importance of this gift to our community in our whole region, this gift by the New England Federal Credit Union. You know, we're all about improving the health of our population. What better investment could we make than in babies born prematurely, our tiniest and most vulnerable. You know, for more than half a century, 50 years, Vermont Children's Hospital has been an integral part of healthcare delivery in the whole North Country, Vermont and Northern New York. And the Level 3 nursery, the NICU, as Dalton put it, really is a resource that serves many, and but for that resource, moms, babies, dads would be traveling much greater distances to get this level of service. This is what it's all about, delivering even these most critical services as close to home as possible. And all of Children's Hospital services are integral to our improving the health of the population. Just recently, under Dr. First's leadership, at our partner hospital in Plattsburgh, we developed a service so that there's pediatricians on call for that hospital for any deliveries, for any sick kids that need to come into the emergency room there. And that's just the kind of approach that we're taking as the University of Vermont Health Network. And when it comes to kids, who is first with kids but Lewis first? So
Good morning, everybody. Everyone can hear me? Yeah. As John said, my name is Lewis First, and for the past 25 years and going strong, I have had the honor and privilege of helping to oversee our University of Vermont Children's Hospital and be chair of the Department of Pediatrics at the Larner College of Medicine. Now, for those of you who are not familiar with our Children's Hospital, where have you been? We have been here for 68 going to 69 years, and from the moment that we were founded by the late Jim McKay, we have strived to provide all of us in this community in Vermont and upstate New York with state-of-the-art, high-quality, child-friendly, family-centered care. And we do that by providing comprehensive children's care in more than 30 pediatric specialties. But what makes our Children's Hospital even more unique are the people. People who come here and really understand what it means, first of all, to be national leaders in the field of pediatrics, in clinical care, in the academic world of pediatrics, in teaching, in research, in innovation, and advocacy. We are getting it done, but always with an eye on this community, on the communities we serve, and on each and every individual patient and family that we care for. And I can't think of an area of our children's hospital that exemplifies what I just talked about in terms of really making a difference nationally, but really doing it here locally to show the rest of the country than our neonatal intensive care unit, which was also founded about 60 years ago by the late Jerry Lucy, who died a year ago this month. And he came to Vermont saying, if a baby is going to be born at our hospital, we need to make sure that we do it right and we show the rest of the country and the world that we're doing it right. So before we celebrate today a remarkable moment in the history of our neonatal intensive care unit, I just want to remind you that the first trials of phototherapy to treat jaundice in this country were done in our neonatal intensive care unit by Dr. Lucy, and the equipment that he used to do this now sits in the Smithsonian. The first trials of surfactant, which is a substance that full-term babies make to help them breathe, but preterm babies don't have, the first trial of artificial surfactant done in our NICU, and that chemical is now used all over the world and is the gold standard to have saved millions of lives, and we started here in Vermont doing that. The first tests of non-invasive monitoring of oxygen levels in babies, done here. And Dr. Lucy spearheaded something called the Vermont-Oxford Neonatal Network, which now brings together, following in the leadership of his successors, Dr. Jeffrey Horbar and Roger Saul, 1,200 neonatal intensive care units send their data to Vermont each and every day to benchmark, let's put and make sure that the quality care we provide to preterm and highly vulnerable infants is the best wherever that care is being provided, and we take full advantage of that. And you will hear that in terms of the metrics and how well the outcome measures are for our neonatal intensive care unit. So we have done innovation, but all the time that we've been doing it, we've been mixing it with the fact that it has to work here first. So I can keep talking about the NICU, but I'm going to take off my hat as chief for a moment and put on my hat as grandfather. Because our granddaughter, who is now 6 years old, was born at this hospital in July, 6.5 years ago, and was born unexpectedly with the fact that her food pipe didn't connect to her stomach. So it stopped, but it did connect into her lungs. So that's a medical emergency. And we found ourselves in July one day welcoming our granddaughter, someone who'd been waiting a long time to arrive, and then being told that suddenly she had a medical emergency and potentially with this kind of an anomaly might not survive. And it was wonderful because the NICU said to me, just you be the grandfather, let us do what we do and do well. And they took our granddaughter and with us right there, and our medical teams, our surgical teams, the exquisite nursing, respiratory care physicians surrounded her and our family. And on that first day of life, she was operated on for quite a while. And not only did she survive that operation, but she thrives. And she's sitting in first grade while I talk to you today, loving school. And the other part of this being thriving is while we have that state-of-the-art care, what the NICU did was surround our family with an enormous amount of love, commitment, dedication, passion that they provided all of us to make us have this beautiful granddaughter that we love dearly and never expected that to happen. But they do that for every child that comes through that unit with that kind of passion that really earmarks our children's hospital, our medical center, and our health network. So it's a very special place. It has made innovation, but it's also made a lot of people come together as a family and love the fact that we could do this local and we can do it well. So rather than hear that from me, I want to turn it over to people who oversee how well we do it and can talk about what happens in the NICU each and every day and why it might be time for a little facility renovation, facelift for the NICU. But the quality of the care that we provide is it's remarkable, it's extraordinary, and I am eternally grateful for what is happening there as the chief of the service, but most importantly as a grandfather of our beautiful granddaughter. So without further ado, let me introduce the nurse manager and the medical director of our neonatal intensive care unit, Michelle Bouchard and Dr. Chuck Mercier, who can tell you a little bit more about how this works.
Thank you, Louis.
It's a pleasure to be here this morning.
Michelle, you and I have worked in the NICU for
A long time.
a lot more than 13 years. We were there with you, buddy.
That's right. And also with Ezra and Evan and Henry as well. And that's why it's so meaningful for us to be here today with all of you so many years after your journey with us.
So true. You know, the NICU cares for hundreds of infants and their families. Some are critically ill, some are premature and critically ill. You can imagine how fragile these infants are.
That's why it's so vital that every single element of the physical environment promotes growth and healing for our babies, and also can support the families during this very tough time.
Now, Dr. first alluded to some of the science that informs our practice, the technology, the equipment.
Coordination of services and support for our families.
Incredible progress in the sophistication, the quality, the care that we've given over the last quarter century in the same big room. And you know, the space is really limiting for families, for the privacy of conversations, for the teamwork of our staff.
And I think our families feel this the most, with no real dedicated space at the bedside to hold their baby, and no place to go to just shut the door to the NICU world and have some privacy.
So in renovating the NICU, this is really about improving the family experience. A powerful opportunity to take the high quality of care we provide and bring it to the next level.
A level that will truly provide a supportive environment, one that the families can relax in and enjoy time with their babies, and also that we can support our tremendous physicians, our advanced practice providers,
Our nurses and our respiratory therapists and our consultants.
and all the staff that make us a wonderful team.
It's now our pleasure to introduce John Dwyer, President and CEO of the New England Federal Credit Union.
Thank you very much. The New England Federal Credit Union has been involved with the University of Vermont Children's Hospital for many years. We've come to learn a lot of, importantly, how much talent and capacity there is at the hospital. A lot of the stories you're hearing this morning about that capacity. When we heard and understood that there was a need to upgrade the NICU and there was a plan around that in the coming years, we really were interested in getting that fundraising off to a quick start and a healthy start. So I'm proud this morning, I'm just the communicator of this, but I'm proud to announce that on behalf of all of the members of New England Federal Credit Union, we're getting that started with a $1 million gift to the Neonatal Intensive Care Unit. I will point out much of what we know about what is done at the Children's Hospital is from the experience of our own staff. We've had a number of staff members who have had children with experiences in the NICU. We now have a number of grandparents that also have experiences with grandchildren in the NICU. And we're fortunate this morning that one of my fellow staff members, Charity Kahaya, is here to talk about hers.
I'm Charity Kahaya. I'm a New England Federal Credit Union employee, and my son Evan over here is a NICU graduate 13 years ago. Evan was delivered by emergency C-section after my placenta ruptured at 29 and a half weeks. So it was a big surprise. He decided he wanted to come early. He weighed in at 3 pounds, 4 ounces, and spent a total of 5 weeks here in the hospital, 3 of which were in the NICU and 2 were in the neonatal transition suite, which prepares infants and their parents for their transition home. I wasn't able to see Evan the day that he was born, and the NICU nurses took some pictures of him and delivered them to me in the maternity ward, which is a really sweet gesture. And it was nice to see a picture of him since I wasn't able to see him the day that he was born. And the nurses were wonderful. They're supportive and friendly and kind and generous with their time and encourage questions. They explained all the tests and procedures that were going to be done. It was a very scary process, but they were very reassuring. Once I was discharged, they told me I could call anytime, day or night, to check in on Evan. Our time here in the NICU was certainly an educational experience. One of the things we learned about was kangaroo care, or skin-on-skin contact, which is a way for us to bond with Evan outside of his isolette. so many families such as mine have benefited from the UVM Children's Hospital NICU, and I'm very fortunate and proud of my employer for supporting this renovation to keep helping more families. I'd now like to introduce Eileen Whalen, President of the UVM Medical Center.
Thank you so much, Charity, and to Dalton for telling your personal stories, and to meet your son as well. Great that he's here, and another graduate of the NICU. There are many out in the audience, so we really appreciate you being here today. We are very, very proud of the accomplishments of our physicians, nurses, advanced practice providers, all the clinicians and researchers that are involved in the NICU. As the only level 3 NICU in Vermont and Northern New York, we take our obligations very seriously to meet the needs of our community. We realize that it's absolutely imperative that we provide the highest level of care and really providing the services in an environment that really will support that high level of care. The quality and the compassion provided by each one of our team is something to be very, very proud of, and personally it's made a significant difference to me. I have a very close friend who just delivered twins a couple weeks ago and got out a little early, was excited, but she felt so confident about the care that was provided every single day. This gift from New England Federal Credit Union will help us continue doing big things with that renovation of this unit and big things for the tiniest patients in our community. So I want to thank everyone for being here this morning, particularly our guests and our graduates from the NICU, and we're happy to take any questions anyone may have as we continue through this journey. So thank you so much for being here today. Join us. It's a big check.